is your question?
Hello.
Just 1 second, let's wait. Okay, so if you have read and understood, consider engage communication skills station, kindly begin.
Hello.
Hello.
Good evening.
Good evening.
I'm Dr. Jahan, one of the surgical doctors here. I understand that you have come for your knee operation, right? Can I confirm that I'm talking with Mr. X?
Yes, I'm Mr. X. Is it my turn now?
Mr. X, I'm really sorry to say that, but unfortunately, my consultant has been called away due to some emergency case, and we are very sorry that we are unable to carry out your case today.
What? What do you mean by that? Do you mean that my operation is not emergency?
Ma'am, of course, you are equally emergency as anyone, ma'am, sir. But your anger and frustration is legitimate also. But actually, the surgical emergency has to be prioritized. That's why my consultant has been called away, and I apologize for that.
Could you please call your consultant now? I would like to have a word with him.
Ma'am, sorry, sir. As I told you that he's dealing with the emergency case, and I don't think he will pick up my call. But I'm assuring that I am assuring you that I will manage an appointment with him, with you.
Could you do it for me instead?
Ma'am, I'm really sorry. I'm not authorized to do such operation without any supervisor.
Then I would like another consultant to look after me.
Mr. X, it is your right to choose another consultant, but I'm afraid it will be time consuming that the new consultant would look upon your case from the very beginning and may reschedule your surgery, which will not be fruitful.
So then give me another appointment now.
I deeply regret that I cannot give you the next available date just right now, but I assure you that I will mention your situation and your circumstances to Mr. Mann, and we will try our best to listed you in the next possible soonest session. I'm really sorry about again, ma'am.
So you promise that I'm going to be able to get the earliest dates? Do you promise that,
I
doctor?
apologize, sir, but if some emergency like this, then we have to be prioritize it again before you. But I'm assuring you that I will try my best.
But see, I have taken a leave from my work for this operation. Now you're telling me that it's getting cancelled, and you're not even sure that you're going to give me another date, and you're not even promising me that you will do that. So how can I be assured? How can I go to work? You know, I cannot just keep on taking holidays from my work like that.
Mr. X, I can really take your point, but I'm really sorry again about this. Actually, this is the emergency case that's have been troubling right now. If you want, I can write a letter to your employer explaining the medical reason behind all of this, and you will need more sick leave. If you want, then I can talk with them also.
And what about my knee? It's hurting me so much. Can I walk on my legs?
I'm really sorry about the pain, ma'am. Actually, sir, there will be some wearing and tearing, and you have to work on some non-wearing exercise like swimming or cycling to keep the muscles and the ligaments around your knee joint to keep strong. And if you want, then I can recommend a physiotherapist who will advise you some good exercise.
And what about my knee pain? The medication that was prescribed before, it's not working at all. I have so much pain, I can barely walk. Could you give me another medication?
Could you please tell me the name of your past painkiller?
I was taking diclofenac.
Okay, then I can see that you have to stop the diclofenac, that it increase the risk of the stomach ulcer. I'm really sorry about that.
Yes, I
And I will
have been
prescribe
having
you.
this heartaches and this heartburns for after taking these
Yes.
painkillers. So could you please give me something that will reduce
Yes,
this
of
too?
course. Yes, I will prescribe you some antacids also. Sir, I can see that you have not eaten from the morning. Is that okay? I get you a coffee or a sandwich?
That would be good. Yes, thank you, doctor.
Is there anyone with you who can go with you?
I have my wife waiting for me.
Okay, that's great. Is there anything you want to ask, sir?
No, not really. I'm just disappointed in this whole situation.
And you want to
I'm
make the
really
complaint.
sorry.
Oh,
Of course,
and do you
sir.
know any place where I can actually file a complaint against this, this conduct, this medical negligence that you have shown?
Mr. A, I can take your point. If I were in your position, I might react in the same way, I understand. But I request you to consider it, sir.
Yes, but I would still like to speak to the authority.
Of course, there is a department calling Patient Advice and License Service. You can go there, but I'm assuring you that it will not happen again. I'm really sorry about that.
Okay,
Is there anything I can help you with?
not really.
So can I summarize everything we have been talked about?
All right, doctor.
So your operation has been postponed because the consultant has been called away due to some emergency, and we apologize again. Then we will contact with you soon for another appointment. Thank you so much for your kind cooperation, Mr. A. We are all here to support and support you. If you have any inquiries, just let me know. I will let my number to the nurses. Don't hesitate to ask me any questions.
Okay, doctor.
You still
Thank you
have
so
1
much for
minute.
your understanding.
You still have 1
Thank
minute
you.
left.
Mr. X, do you have any questions?
You think
Mm,
if there is anything else you've missed?
no, it's all right. I will now take your leave then.
Okay.
Thank you so much, Mr. X.
Thank you, doctor.
All right. Give the feedback, please. Since you still have 30 seconds left. Yes. What more could have been better or could have been improved? Patient
Yes, ma'am.
was not
I'm
aggressive. Patient
Ulfa
was very,
Tapu. That's why the sound
was
is
very
female.
soft.
That's why I was ma'am.
I thought
Yes.
she'll be a little aggressive, but maybe her baby.
Ma'am,
she had to be careful.
No. I thought I wanted to be aggressive, but actually
No,
the
but
first
you
time
were
when
not. You by nature you're soft.
No, because I wanted to go ahead like how we would practice before, but she got nervous. You could feel that Dr. Tinsina
No,
was
no.
nervous. So I
She
was
wasn't
like
nervous
getting
this
scared
time.
if I bring on
She
my
started off pretty
anger.
much confident. No, I'm sorry.
Yeah,
This time
later
she
on
was
she
pretty
started.
much confident. Someone has raised hand.
Yes.
Yes, please.
So I did not want to be like very, the last time I would go and somebody would be like, "Oh my God, is she shouting at us?" And I'm like,
No.
I'm just
No,
playing
it is
my role playing.
Patient will do
I'm
that.
mentally prepared for. I'm
Yes, she
mentally
was.
prepared for it.
I could
Yes.
feel. Yes, she was. Yes, Dr. Daniel, you want to give feedback?
Yes.
You are more like
Good
anxious
evening,
patient.
ma'am.
Sorry?
Good evening, ma'am.
Good evening. Yes, please.
Yeah, good evening, Dr. Tijan, Dr. Ufat. Was a very good one.
Good
Yes.
evening. Thank you,
Good
doctor.
evening.
I think she brought her A game into it.
Yes.
Yes.
Yeah, she did well. She flew. She flew with the discussions, and then she addressed the patient's concern.
Yes.
And she ended well as well.
Yeah.
She also asked the patient where, if he came with any relative, so that they can accompany the patient home.
Yeah.
And then she also talked about the pulse and then the complaint, which was
Yes.
quite good.
Yes.
Yeah, I was thinking then, if particular station, is it, I was thinking maybe we can tell the patient how far, what do you know about your condition, so that the patient can tell us. Is it proper that way?
No, in this scenario, patient will be sitting and waiting eagerly. As soon as he will see the white coat person approaching to him, patient will literally jump onto it and would say, "Is it my turn now? Is it my turn? Do I have to go in now?" Because patient is fasting and patient is in too much pain and patient is really frustrated and angry and patient
Okay.
really wants
So
to go
this
in.
is not the station where.
No, here patient will be like, patient will be in more hurry and in more angry kind of patient would be there and will be sitting like, and when this candidate will break the bad news that unfortunately their procedure has been postponed, patient is not going to take it that easily. Patient will be angry, patient will show aggression that why isn't my
Thank you,
pain
ma'am. So this patient
important?
is not the one without the patient to.
Patient would be aggressive and patient would be angry. It won't be that easy and comfortable. And this breaking the fast, she would have to offer that earlier. That can I offer you something to break your fast first, so that you can eat something and relax, and then we can talk about it. So she would have to make that offer first, or before, or earlier.
Okay.
This
Okay,
is
ma'am.
my point. And when you were telling about the physiotherapist, and you were suggesting that physiotherapist will tell you about the exercises to strengthen your knee joint. This word you have to add.
Yes, ma'am.
Exercises.
I have told.
Yes, but not the word to strengthen your knee joint. You've just said that I can recommend you physiotherapist who can tell you some exercises, but to add
Okay,
the
okay.
word,
Yes.
yes, that
Strengthen.
word.
Okay.
Yes,
Okay. Thank you, ma'am. So in this
Thank you.
station, we don't tell the patient to know how much the patient knows.
No. It's basically this
Okay,
is
thank you,
breaking
ma'am.
the bad news. You'll break the bad news. The
Okay.
moment you'll break the bad news, patient will jump onto you. Patient will be sitting
Okay.
on the edge, waiting for his turn to go inside for the procedure. And patient is the postman. It's very difficult for patient to.
And
break the
he
news.
already rejected 2 times earlier before
Yes,
that.
patient was cancelled twice before.
Okay.
So
Thank
this
you,
is
Yeah,
ma'am.
that's
third
why
time.
he is more angry this
Yes,
time.
and is not going to accept your sorry. But here, one thing is that I've discussed before as well. What are other sentences that you can use instead of "I'm sorry, I apologize," but they mean the same?
I deeply regret.
Yes, unfortunately,
I awfully
has.
sorry.
Yes, unfortunately, it has happened again with you.
Unfortunately, yes.
You can use more these sort of empathetic words instead of just "I'm sorry, I apologize, I regret." Unfortunately,
Okay,
it
ma'am.
has happened again. It can happen again as well. I'm afraid. So you can add more words accordingly.
Yes, ma'am.
according to the situation. Good. Thank
Okay.
you.